Books have been a big part of my life.
For decades, Bob Summer has lived and worked surrounded by books.
Books are wonderful. Books change lives.
And as Bob found out, so does cancer.
I actually had cancerous tumors in my bladder.
Bob's doctors recommended removal of his entire bladder, but instead of an open surgery with a large incision, Bob chose to have his bladder removed and a new one, called a neobladder, constructed via a robot.
It fascinated me, the level of technology. Again, it was like being in Futureland or something.
It's like playing a video game.
A very complicated one. Dr. Eric Castle and his team access the bladder through tiny incisions. After properly placing the robotic tools, he sits at a console and controls them.
When we move our hands, the robot will move its arms. If we stop moving, the robot will stop moving.
During the operation, Dr. Castle removes the entire bladder and prostate. Next, he uses part of the intestine to create the neobladder, which he then hooks up to the urethra. He says the robotic approach has several advantages over standard surgery. The biggest is that it's much less invasive.
The advantage of the robot is that our blood loss is significantly less and the hospital stay is shorter.
And he says there are fewer complications.
The recovery was very fast. I was out of the hospital in 4 days.
Not only is Bob thankful that his cancer's gone and he's back in his bookshop, but he's also amazed at how normal he feels.
All the plumbing works pretty much as it did before. So that, talk about magic.
Bob says almost everything he knows about life he learned from works of fiction. And what he's learned about his own story is that now he can live on cancer-free. For Medical Edge, I'm Vivian Williams.